his presentation. I will just go through his presentation and I will focus on few important points. He has studied many IOLs through eye tracy aberrometry in his practice, and he has studied a lot of Edofs IOLs. So as Sir Duke Elder said that a human eye is the most complex and most imperfect optical system. So even in a normal eye, we get a lot of these aberrations, okay. Some of these are good, some of these are bad for the eyes, and we have to see the objective analysis so that we may have some understanding beyond just 20/20 vision. So Dr. Nitin has already, told about few of these values which he has noticed in his experience of MTF values and what is the contrast sensitivity. So there are a lot of sources of degradation in the image. So we have to understand that the image is formed from tear film to corneal aberration, then through the pupil, then the lenticular or IOL aberrations, and then on retina. So even if you have a patient who has a lot of aberrations, you have to also find out the source. Sometimes the patient may not necessarily have very high aberrations because of IOL, but it may be related with tear film itself, or sometimes missed corneal opacities or nebular opacities, which is common. So sometimes we use a particular IOL and patient complains of aberrations, and we think that it is because of the IOL, but sometimes the reason may be in the tear film or cornea, or it may be just because of the large or very small pupil size. So these all things you have to consider. I will just go through, I will not speak about, very fine things on the eye tracy, because most of us may not have access to it. But I think Dr. Nitin focused on the MTF value. Okay. So whenever you have MTF value which is less than 0.4, I will just show you in the graph here. You can see that red zone there on the left lower corner. So whenever you have MTF value above that, okay, usually patients have good clarity of the vision. When it goes in that red box, patients generally have a poor quality of vision. Now, he has compared different MTF values. I will just share that because that's very, very interesting. And okay, I will just show. Okay, there are a lot of slides and lot of patients he has examined. Yeah, this particular thing I wanted to, and in fact, Dr. Nitin in his presentation showed, different comparisons of different IOLs. And what I would like to highlight here, you can see the Clarion monofocal here. So Amit has found out that the MTF value, 5 cycles with the pupil size of less than 3 millimeter was best with monofocal, right? Clarion monofocal, and that's what we expect, that monofocal has least aberrations, so it's almost 89%. And as compared to that, as you go on from, down to up, Panoptics, which is a trifocal, MTF is reduced to 74, bifocal, multifocal, 71%. Even a monofocal plus IOL, which has high, I told you about pure Edofs to begin with, magnificent, which has a 1.2 addition, you will find its MTF is dropped little bit down to 74%, almost equivalent to a trifocal, right? And when you come to Autofocus Pro, it's 55%, okay? Lucidis is 65%, okay? And what is the common thing? Anybody would like to guess in these? Generally, the refractive Edofs, okay, if they have very high addition, reduces the MTF function, okay? So if you have a refractive Edofs which has very high addition +3 or more, it's going to give rise to lesser contrast, okay? That is to be understood. As compared to the same addition in a diffractive format, okay, may not give very low MTF function, right? So you have to always keep in mind. So always, whenever you have a patient, I think these are the few tools which you can use to check the exact aberration profile in that patient and find out what is the exact reason for patient's dissatisfaction. Because sometimes, as I said, tear film or corneal problems or decentration of IOL may be the major problem which is causing the aberrations and not the IOL itself. So no lens technology is a perfect replacement for natural crystalline lens, but luckily most of our patients adapt to it, even if on objective analysis we see lot of aberrations. Okay. Thank you so much. So this